Hi and welcome to another episode of Shoulder Guy TV. My name is Luke and I'm the Shoulder Guy. So, you think you've got a shoulder pain problem, do you? Well, let's be sure. Okay, it's really important that you make sure that you actually do have a shoulder pain problem that you can fix, or that you can go to a physiotherapist and get fixed, or you can go online to theshoulderguy.com and access one of our products so that you can actually work towards fixing your own problem at home. Now, the reason that I say this is because there are a lot of other diagnoses or other potential problems which can masquerade themselves as shoulder pain. Now, one of the most sinister ones, which we really want to make sure that we diagnose very quickly and very early, are tumours. Okay, 7% of all tumours within the body actually are up in the shoulder. Okay, and one of the most common ones are the ones that that most commonly refers its pain to the shoulder is the Pancoast tumour, which actually starts in the apical section, the upper section of your lung, and then refers pain directly out to the shoulder. So that can be a reason for acute shoulder pain. So 7% of tumours are found in the shoulder, and of all the tumours that are in the upper limb, 70% are up in this proximal humerus, so they end up high in the shoulder. Sometimes they are the primary cause, and other times they are metastases of a primary tumour elsewhere in the body. Now, the heart and the diaphragm can refer pain out to the shoulder, so we've got to be careful of these visceral referrals of shoulder pain out there. And another reason why you need to double check your shoulder pain is because some people have a diagnosis of frozen shoulder. They actually have a tumour, or they might have what they call avascular necrosis, which means the head of the humerus, the ball part, is actually dying off. It's necrotic, and that's what's giving them the pain and the stiffness, which mimic the symptoms of a frozen shoulder. Now, tumours are the most important things, okay, and it's really important that we get a very good clinical diagnosis, and also we match that with really good investigations, so plain x-rays and MRIs. But it really doesn't take the place of a good clinical examination and some healthy suspicion. Okay, it's really important that you're suspicious about things when you're examining someone with shoulder pain, or for you at home, that you're also suspicious about why you could have shoulder pain. And it's not always because you actually do have shoulder pain. The other area which could refer pain into the shoulder is the neck, obviously. The nerves that come out from the neck into the brachial plexus, they can refer pain into the shoulder too. So we've got to be careful about neck movements, and also pain that might be starting in the neck and then referring out to the shoulder. Now, what I wanted to give you right now is some common things to look out for, and we call these red flags. Okay, these are the big red flags that we need to identify, which could lead us to a diagnosis of something that's more sinister in terms of a reason for your shoulder pain. So let's go through those now, because they're really important. Okay, night pain. Now, night pain is common when we're looking at a shoulder problem with bursitis particularly, but night pain without a loss of active range of motion or passive range of motion. Okay, so if we've just got this night pain which is severe, but we see no loss or no real effect on the shoulder, then this is something that we need to pay attention to. Constant pain is something that we need to pay attention to. We don't mind severe pain as long as it's variable and it might be mechanically related. But if we have constant pain that's independent of activity, doesn't matter what we do, we've got this constant pain that's in the shoulder, then this potentially could be a red flag, so we need to pay attention to that. Now, obviously, if things just don't fit, okay, this is where we're putting everything together, and if something just doesn't fit with the pattern of what normally is shoulder pain, then we need to pay attention to it. The trouble with tumours and the like, they can mimic rotator cuff disease, okay? You can get positive impingement signs. You could on an MRI see that there actually is a rotator cuff tear, and we go directly for that, okay? It's the easiest diagnosis. There is a tear, there must be shoulder pain related to that tear. But if we discount these other things, then potentially we're going to make the diagnosis of a rotator cuff tear, which is now contributing to shoulder pain, but in the background, we haven't investigated fully enough, we haven't asked the right questions, we might have a tumour that's mimicking itself as a rotator cuff problem. So this is really important. Let's continue. Fever, okay, or feeling generally unwell. Now this is also something we want to make sure that we pay attention to. We're just not feeling that well. Then also unexplained weight loss. It doesn't have to be massive weight loss, but it could be something that's unexplained. But if we put some weight loss together with a fever, with constant pain, now we're starting to build up a picture that things just don't fit. Now weakness, muscle wasting, or motor and sensory loss. So this is where neurological problems begin, okay, when we have motor and sensory loss. But if we're noticing, global weakness or muscle wasting in and around the shoulder or the body, then this is potentially a red flag. If we notice masses, so some people actually have a palpable mass up in the upper chest area, this might be an indication that something just isn't right. Now cough, okay, if we're noticing something on the chest, that might be the primary tumour or the primary location for the malignancy. So a cough could go along with some of these other symptoms and signs as well. So an unexplained cough is something that that doesn't sound right, let's pay attention to that. And obviously I've mentioned that before, cardiac symptoms too. So some of these things, they all have to come together. You don't want to just pick one out, but we could have a few here if we ask the right questions that are going to paint the picture of a shoulder pain problem that is outside of what we would expect normally. Okay, but the trouble is that some tumours can mimic the exact shoulder pain or the exact rotator cuff lesions that we're trying to treat. And we're trying to be helpful, so we say, hey, this must be a rotator cuff problem, let's treat that. And all the while, we're delaying the actual diagnosis of a tumour. So this is really important. If you think you've got a shoulder pain problem, make sure that you do have. Consult your physiotherapist, consult your doctor. And if you are at all concerned, okay, you've got to bring some of these symptoms up. Be forward, get on the front foot and let your doctor know that you have constant pain potentially. You've got a cough, you've got weakness or unexplained weight loss, and things just don't seem to fit. That could help them make the diagnosis. That could potentially solve your problem fast and potentially save your life as well. My name's Luke, I'm the Shoulder Guy. I hope this has helped you. I look forward to seeing you again soon on another episode of Shoulder Guy TV. Bye for now.